I'm between you and lunch right now. So, I only have two stories, maybe, or two things I want to talk about to start with. One would be, when you think about collaboration, you think amongst peers, and you think amongst equals. Why do we have medical direction? Seriously. So, as a premise of how I do a lot of work in Canada, is I really take the hardline view that we work amongst peers. And when I look at working amongst my peers, I include occupational therapists, pharmacists, nurses, and physicians. No one stands higher on the ladder. And that really is an important principle to start with, because sometimes it puts me in conflict with other groups. But I think in terms of the maturation of a profession, there we go, maturation of a profession, that we have to be amongst equals and not necessarily one step further down the ladder rung. So as part of the maturation also has really been a choice to take ownership of all of those things that relate to your own profession. And over the last number of years, I'll talk a little bit about our National Competency Profile and as we move to baccalaureate education, but also taking a look at the broader sense of paramedics and how we fit into society and how we fit into healthcare, is that we really do have to take ownership of those elements by which we partake, and not to partake as a silent partner, but as a true partner. And that really does take an investment. So just to give you a little bit of the history, it's interesting how 2001 came out. Since 2001, community paramedic programs have really been evolving significantly across the country. When Gary showed that first map of Nova Scotia, some of you might know where Digby Spit is, but it was this little chunk of land that are a series of islands in the Bay of Fundy. And that was one of the first, I guess as part of folklore now, we say one of the first community paramedic programs in Canada was Longbrier Island. So there's been an incredible evolution of these programs, both rural and urban, and for many different reasons. Everything from providing care in remote communities to trying to reduce the number of 911 or 999 calls in urban communities. And more recently, and I think Jackie's going to speak about it in terms of providing palliative care, which are all really kind of important pieces that now paramedics are extending our depth and breadth of who we are within the healthcare community. And that really is an important theme when I look at the National Competency Profile for paramedics. The first item was that in 2001, that was probably 4 years worth of work that went into the development of this profile, about $3 million, cross-country, pan-Canadian, everybody was involved. And it was a wonderful process, but really it defined paramedics as a set of knowledge, skills, and abilities. It really didn't define who you were, it defined the tasks that you could perform. It was something that was absolutely outstanding. I mean, as in we didn't have it at the time, outstanding. And it was an outstanding piece of work in terms of what it did. The intent of it was also to get to a curriculum. It never made it to that level, but it didn't really make it to a very granular level in terms of including sub-competencies. And it defined the paramedic very much as an emergency responder. And I really do stress that in terms of the emergency response component. So after 2001, I mentioned the Longbrier Island community paramedics. All of a sudden, we're extending our reach into the community, into non-urgent care or non-emergent care. And by 2011, when we did the first renewal of the profile, we really did kind of just plant the seeds at this point by adding components of public safety and of public health within the profile, but not to the level that was absolutely required. I just put that little piece out for the baccalaureate 2025. Over the last 3 years, we've been very much working on that. And we've been making use of, it's called CAN-MEDS. It comes from Royal College of Physicians and Surgeons. And it's a model that very much uses the concept of what are the roles that an individual undertakes as opposed to what are the tasks that they perform. And I can do a separate presentation on it. But once again, the baccalaureate education, the baccalaureate 2025 as entry to practice is absolutely the goal going forward. So at issue was, with respect to community paramedics, is that, so we have a point in time, 2011. We don't have baccalaureate as yet. So should we just revise the profile and add these knowledge, skills, and abilities? Option A. Or we could just photocopy all the great work that Gary did in Minnesota and circulate his curriculum. But we chose a different tact, and we chose to look at it from a standards development framework. And I apologize to everyone. I think this is the most boring subject of all, except for people who are interested in standards. And we chose to look at standards as a way of going forward. I think in the States, there's over 300 standards agencies. In Canada, a couple years ago, there were only 4. Now I think there's 8 or 9. So we decided to take very much that the paramedic community, we would own this. And we found a good partner in the Canadian Standards Association, one of the 4, well, there's 8, but one of the 4 main. And we had to figure out how to articulate this into the idea of a new baccalaureate education. The opportunity came in terms of, like a lot of things, all of a sudden there's funding available. And there's this group in Canada that funds research called the Canadian Safety and Security Program. It's kind of a long snakes and ladders thing to figure out where all the money comes from. But essentially, we've been producing back-end work supporting documentation to build our arguments for research grants at the federal level. And the first seminal piece comes from the Paramedic Chiefs of Canada, their white paper in 2006. As dated as 2006 is, it really is current. And a lot of the concepts still hold true. And then those other documents are really just ideas to say, you know what? We're committed to this. We've done our homework on it. We know there's a gap. We know there's a need. Just give us the money and we'll do the job for you. So the Canadian Standards Association is a great partner. Of note would be just the fact that what gives people, I think, confidence is that they do have a robust process. And that's very much inclusive of, you know, the steering committee, the technical committee, and basically a consultation process that leads you to a final outcome. Interesting, you know, different things that pop up along the way when people mention things. In terms of how we looked at this, and some of the people who are on the committee in the room here with me today, we really wanted it to be patient-centered. We took the IHI's triple aim, and really looked at as a baseline, and that should say PEPA model, M-O-D-E-L. And we took that from nursing in terms of how you would create a standard or a program with respect to community paramedicine. So that's the baseline of what we did. Where are we at? In November, the documentation was completed. It went through its 60-day consultation. We met last week. Yeah, I think last week, for the technical committee review of all the comments we had. And part of that process is that of every comment you get, you have to respond to every comment. And we're just in the final stages of doing that record part, and then it'll go out for a final balloting. That really is kind of the important piece there, is the standards component for all of us. As we talk about the next steps, all of those elements in terms of promotion and implementation evaluation. So that really is the sum of where we're at with this. I'd like to tell you just my one anecdote about where we're at in terms of community paramedicine in Canada. Gary mentioned earlier on his list of slides and the funding models or the funding commitments that have been recorded over the number of years. And a lot of these things, and many of you would appreciate that you do plant a seed and water it. We've been working with the federal government for the last 5 years or so in a very, very positive way on community paramedicine. Recently, about, I don't know, a month ago, I got a phone call from the minister's office, asked us to appear at a round table Basically 4 days later, we appeared there. We were one of only 2 other health professions and a number of healthcare providers. And in terms of talking about healthcare, a week later we got a call to another roundtable on healthcare, on home care again, sorry. The idea here is that the federal government has about $11 billion to give out. I don't know, that's about 8 billion pounds. And the Minister Philpott, she has worked on a community paramedicine program as one of the researchers. And she was actually very straightforward and honest in her assessment during these roundtables. And she kept on asking for something tangible, because people were talking about the lofty goals of Triple Aim or about restructuring healthcare and all that. The paramedic community, we were huddled afterwards and we said, well, should we put in an official notice in terms of saying, should we ask for $100 million or something like this? You know, some crazy number that we could never even fathom. We got a phone call just shortly thereafter, basically telling us, don't put anything in right now because you'll grossly underestimate where you're at. And that really is kind of the power of having engaged the medical community and the minister being familiar with the programs across the country. That, you know, I've been absolutely impressed with her commitment to it. And it's something that would be something that would be as a national program with the money flowing from there to the provinces. So that's just my short little good news about, I think, where community paramedicine is in Canada and where it's going in the near future.
So Pierre, when do you think the community paramedic standard will be published?
I think that should be by the end of spring. So I'm thinking by end of April or May that it will be published, and that it becomes part of all those other standards documents that become available internationally, right? I think standards committees belong to an international standards organization, and they all have to follow the same rules in terms of how they put forward their documentation. Okay.
And at the ALF conference, there was some discussion about paramedic psychological health. Could you take a minute and talk about that standard
Sure.
as well?
So if I'd gone back to that one slide where I listed all those lists of foundational documents we'd pulled together, working with the chiefs and with different groups of paramedics across the country, we got a separate grant application to create a specific paramedic psychological health and safety standard. So in Canada, there's a Z standard called Psychological Health and Safety in the Workplace. We put an application to say that works fine for workplace, which really is a 9-to-5 cubicle heaven office building. We would like to create one that is specific to the environment in which paramedics work. And we got funding to do that. And that right now is at the point that their our first technical document should be complete by June. And our process hopefully will be done within a year as well with the Canadian Standards Association once again.
All right, thank you. And did you officially adopt the 2025 baccalaureate requirement yet?
What does officially adopt mean?
Are people planning that that's what it's going to be?
It's kind of one of those organic things that I've said it in a number of places. I don't know if it's ever been written officially.
Okay, all right. Very good. We've got a little bit of time for questions. Any questions for Pierre?
It's lunch.
Yeah, people are hungry. All right. Well, thank you, Pierre.
Thank you.